Well, good morning, everyone. Ashley Klingon-Smith. I am State Director with Americans for Prosperity, Pennsylvania. We are coming to you with a very timely discussion with two trusted experts who I have the privilege of introducing in just a moment. But I want to set the stage for a healthcare conversation that we're going to have over the next 20 or so minutes. 70% of Americans think and believe our healthcare system is not working and that it needs to change. And indeed, that is the problem. It is the system. It is burdened with bureaucratic red tape and hidden prices that are making care too expensive and providing us with too few options. And there are many people in Washington that believe more government interference in this system is going to give Americans what we all really want, which is more choice, greater access at more affordable costs. And as so many of they call that a public option. But we know that this is not going to work because government failures have been exacerbated throughout this pandemic. Defunct testing kits, PPE shortages, so many state laws that limited where patients and healthcare providers could be treated or where they could practice. And so doubling down on this approach and growing the status quo on the system is not going to work. But there is an alternative. We introduced it a couple of months ago, and that is a personal option. It's a set of smart, sensible principles that are going to keep patients at the center of the conversation, not some government system. We unveiled the Senate reforms, and today we want to highlight drug price controls and how that is going to adversely impact that principle of affordability. So I am thrilled to introduce Dean Clancy. He is AFP's Senior Policy Fellow for Healthcare and the President of the National Taxpayers Union, Pete Sepp. Like AFP, NTU is a nonprofit, nonpartisan organization working for lower taxes, smaller government, and economic freedom. They are a trusted coalition partner across numerous priorities at AFP. So, gentlemen, thank you so much for being here. Dean, I want to start with you and to address some of the healthcare implications of price controls. And then Pete, we're going to turn to you to share some of that impact on taxpayers. So Dean, what in the world is HR 3? What is this legislation going to do? And how is it going to impact patients?
Well, thank you, Ashley. That was a great introduction. You've set the table beautifully. You're right. Price controls are a problem. They're a threat from Washington. We don't need to go down the road of price controls. HR 3 is a price control bill. Americans are concerned about the cost of prescription drugs, and politicians have responded by putting together proposals, some of which are not very smart. And HR 3 is probably the worst of the lot. And unfortunately, that bill, which was drafted a few years ago, is now moving through Congress, and there's a threat that it might become law. And so that's why Americans for Prosperity and NTU and other similar liberty-minded groups are opposing the legislation. What does it do? It basically imposes caps on the prices of prescription drugs through the federal Medicare and Medicaid programs, but it would also affect all the private health insurance companies in America because those companies tend to piggyback or emulate the policies of Medicare. Medicare is the 800 billion pound gorilla in American healthcare, and what Medicare does affects everyone else. So you, dear listener, will be affected by these drug price controls. It does it in several different ways. It says that Medicare's bureaucracy will negotiate prices, reasonable prices, supposedly, with drug companies. In reality, it would be a one-sided negotiation, basically price dictation. That would lead to drug shortages, to a stifling of innovation, and needless suffering and death. 4,000 years of human experience have shown that government price controls lead to shortages, rationing, and needless suffering. The bill would also impose a cap on price increases of pharmaceuticals. They couldn't raise their prices faster than inflation without being punished by the federal government for doing so. This would be implemented ultimately by a new government bureaucracy, an affordability board that would be charged with determining a reasonable price for every new drug. And it would be enforced through a draconian excise tax that would in effect confiscate all the profits of a drug if that company refused to play ball with the feds. So the short version, Ashley, is HR 3 is really misguided legislation that would impose price controls on Americans, leading to needless drug shortages, rationing, and suffering.
Wow, that is frightening. Pete, welcome. I am excited to hear, your point of view and perspective that the impact of HR 3 would be for taxpayers. And I would value you sharing a bit about what was contained in the letter that you all recently sent to HHS Secretary Azar. It was signed by over 150 economists. So would value your perspective from NTU. You guys represent, I always say, the least organized, most underrepresented constituency of them all, right? Which is the taxpayers. So thank you for what you guys are doing. Share your thoughts.
Yes, thank you, Ashley. Often the most tread upon constituency, too. And HR 3 unfortunately continues this sad tradition. Aside from the 95% excise tax that Dean mentions, which is described somehow as optional if companies don't wish to bend to the negotiated price that the government dictates to them, they can always pay that tax on their gross receipts, by the way, which is a big no-no in tax policy. Many states and other countries are actually trying to move away from that concept. So that's flawed in and of itself, but taxpayers have a real stake here in the way that our system of prescription drugs functions in the United States. No other country in the world has this great balance between access to blockbuster drugs. Up to 90% of the newest drugs are accessible to Americans as opposed to half that rate in other countries, and affordability. In other words, 90% of most prescriptions filled in the United States are for generics, a much more affordable alternative to brands. You can't upset that balance with a bill like HR 3 and not have consequences for taxpayers. And in fact, this has been documented. Take, for example, NBER, a study by the National Bureau of Economic Research. It said that for every dollar of additional spending on new blockbuster prescription drugs in the Medicare program, overall expenditures in the program dropped by more than $2. Why is that? It's because prescription drugs end up replacing more expensive therapies like long hospital stays and surgeries. And so the current system without price controls is actually delivering value for taxpayers. That was a point we made almost 2.5 years ago now, but still very valid today in a letter signed by 163 economists. Very well regarded economists, Vernon Smith and others who are Nobel Prize winners. They spoke out at the time against a Trump administration plan to link part of the Medicare Part B program's drug prices to an international reference pricing index. In other words, take a basket of socialist countries' drug prices, create an index out of it, and say, okay, the drugs that Medicare Part B pays for can't exceed these prices. Well, predictably, as Dean said, of course, with 4,000 years of experience, these economists wrote a fairly blistering letter to the secretary saying, and I'll quote this, setting price controls at below market rates leads to shortages, squeezes the cost bubble towards some other portion of the economy, and imposes a dead weight cost on society. In the case of drugs, it leads to a reduction in patient access, less investment in R&D, and cost shifting that raises the prices of other therapeutics. And so the economists were warning the Trump administration at the time of the dangers here, not only to patients, but also to taxpayers. Now, this warning is echoing for supporters of H.R. 3. This is a very dangerous course. And I would point out, again, no other country in the world has this kind of environment for drug development, access, and affordability. We upset this balance not only at our own peril, but at the peril of patients and taxpayers around the world. It was Richard Nixon, actually, when discussing wage and price controls 50 years ago, who told his Treasury Secretary at the time, the problem is that these expletive deleted things will not work. He tried them anyway. He was taught the lesson of 4,000 years of history. We're about to learn it again unless we stop H.R. 3.
Wow. Dean, what is the impact to prepare for future health crises should H.R. 3 pass?
Well, I would venture to say, Ashley, that we might not have a COVID vaccine today if we had had a policy like H.R. 3 in place in the past few years. That's the effect it has on innovation and the ability of the private sector to bring new life-saving therapies to market. We don't want to kill the goose that lays the golden egg. And H.R. 3 would do that for all the reasons we've discussed, and it's needless. We don't need to do it. The pandemic has showed us that the way forward is not to impose new government barriers and price controls, but to remove them. The bright spots of the pandemic were when we removed barriers to hospitals expanding the number of beds to meet the crisis, barriers to doctors and nurses practicing across state lines, barriers to people communicating with their medical professionals through telehealth. Those were all barrier removal strategies that worked. We saved lives doing it. H.R. 3 goes in exactly the opposite direction, imposing new barriers that ultimately will make it harder for us to respond to a future pandemic.
You know, at the top of our time together, I talked about the fact that patients want three things. They want more control, they want more access, and they want greater affordability. That's the trifecta. We know we can get there with a series of reforms that are smart, that are sensible, and that are pandemic proven that we've experienced over the past year. But Pete, I really want you to punctuate the point. Is H.R. 3, because this is what we're hearing from Capitol Hill, is it going to lower prescription drug prices?
In the long run, not at all. And in fact, it will raise prices in the overall healthcare system as time goes on. All those drug discoveries that President Trump's Council of Economic Advisors said would not occur under price controls. In fact, 100 undeveloped drugs over 10 years was their projection. Those undeveloped drugs will end up raising the prices of the healthcare system because other therapies that are more costly will have to replace it. Now, just like raising the minimum wage, for example, can you say that capping drug prices will somehow reduce the costs to certain people who are paying a lot right now? Sure, but then almost immediately thereafter, other negative consequences begin to take hold. The cost bubble gets squeezed to other parts of the insurance system, or drugs simply go undeveloped, or drugs that we currently have developed that are price capped are no longer available, leading to shortages. That's basically the principle that we experienced when we started enacting price controls on gasoline in the 1970s. Some of us are still old enough to remember our fathers and mothers waiting in line for hours just to fill up the tank. Can you imagine the impact of a shortage of prescription drugs? It wouldn't be waiting in line. It would be getting sicker and potentially more folks dying.
It's frightening, and it seems to be moving, the conversation in the exact wrong direction, again, from what patients across the nation are demanding. So I want to end on a high note with some solutions. This goes to both of you, Dean and Pete. What are some better ways that we can make drugs more affordable while ensuring that folks are not losing access to the prescriptions and drugs that they need?
Well, if I can jump in there, Ashley, I would say we need what we at Americans for Prosperity call a personal option for prescription drugs. Instead of price controls, let's empower consumers, markets, and competition to bring down prices naturally without leading to the negative effects of HR3. Four things in particular would really help. This is our better alternative. I'm sure listeners are asking themselves, boy, you hate HR3 and price controls, but what's your better idea? Well, I'm glad you asked. First of all, faster drug approvals. The Federal Food and Drug Administration slows down the approval of new life-saving drugs significantly, not just by months, but by years. Often people in other countries have access to drugs that we Americans don't for years because FDA is a bottleneck in the system. So that's point one, speed up drug approvals. Second, let's have more generic alternatives in competition. Often a drug is expensive because it's on patent, a temporary monopoly. As soon as it comes off patent, the price should drop as competition begins. But sometimes drug companies play games to, in effect, prolong their monopolies. Let's end that game playing, pay for delay schemes, blocking, paying companies not to compete, and so on. Let's go ahead and clear the market so that real competition occurs. That's the second point, generics. Third, let's let everyone save tax-free and spend tax-free for prescription drugs and healthcare. We have a tool right now that will let you do that, but we have to remove some barriers. That tool is called a tax-free health savings account, or HSA. About 10% of Americans already have them, and it's a great tool. It saves you between 10 and 40% on every purchase you make out of the account. Unfortunately, about 9 in 10 of us have no access to an HSA. If everyone did, it would in effect be a discount for people who purchase prescription drugs through their account. And fourth and finally, we need a better Medicare drug benefit. Medicare, the original Medicare program from the 1960s, has never covered prescription drugs. They had to add a specific new drug benefit in the early 2000s called Part D, which is an optional add-on. You have to pay extra for it, and it's poorly designed. It doesn't cap the cost of your out-of-pocket drug expenditures. You can go broke despite paying premiums for Part D drug coverage. It also has an odd thing called the donut hole coverage gap, where basically you pay extra from a certain point up to a certain other point. No modern health insurance plan is structured like that. Medicare Part D is poorly designed. It can be fixed, and we can do it in a way that is cost neutral for taxpayers. So let's fix Medicare, give everyone an HSA, and have more generic competition and faster drug approvals. That's the way to get prices down without shortages and harming people. I'll just end with one thought. Milton Friedman, the Nobel-winning economist, famously said, if you put the federal government in charge of the Sahara Desert, in 5 years, there'd be a shortage of sand. That's what we're trying to avoid.
Absolutely. Pete, the floor is yours.
Well, I would point out that Dean's fourth suggestion among the excellent ones he outlined is a bipartisan proposal in Congress to redesign the Part D benefits. So that stands a good chance of being a viable alternative to what's moving through the House of Representatives right now in the form of HR3. I would also add, we should be looking at reforming the 340B program that provides pharmaceutical access to some of the poorest Americans right now, but the program has really gone off the rails and has not been serving its original purpose lately. We should also be taking a look at trade negotiations. Renewal of Trade Promotion Authority is coming up in a couple of months in Congress, And we can require as a negotiating objective, making sure other countries don't impose their price controls on us or their own citizens, and working to push back against countries that are trying to undermine our intellectual property protections. Those help drug development right now, and undermining them, well, that's going to lead to all of the fiscal problems for taxpayers and the health problems for patients that we've been talking about. Another thing has to do with tax policy. Prescription drugs are a very research intensive activity. In fact, pharmaceutical industry spends upward of 25% of its revenue on research and development. We need to support that in the tax code, not in the form of a subsidy or a carve out, but rather to make sure that research and development across the economy has a stable tax credit and a low rate for allowing anyone in any industry to invest in those kinds of activities. That provision of the tax code that was changed to the benefit of the American economy back in 2017 is coming up for expiration. We have bipartisan legislation that can fix that. We need to move forward with it.
Gentlemen, thank you so much for lending your expertise and taking time to discuss this critical issue. It warrants our advocacy and our activism to ensure its defeat. We have highlighted over the past few minutes, the alternative and the right option. We know government price controls are going to lead to rationing and scarcity, but through competition, you heard Dean, you heard Pete say it, approving more generics, speeding up the bureaucracies that currently exist at the FDA, we are going to be able to achieve greater availability at more affordable costs. So we've talked about the personal option. It is not a complete overhaul of the system. In fact, Americans don't even want a complete takeover of the system. They just want to fix what's broken. And we know we can do that through a set of smart and sensible reforms like we just talked about. And so we are asking you all to visit apersonaloption.com, read all about some other ideas in addition to price transparency that we have. And there is a link to a pledge. We are asking you to join the tens of thousands of individuals who have already signed that pledge saying, hey, Washington, it's time to embrace a different idea, embrace some outside of the box thinking that's already been proven beneficial for patients and providers alike. And in Pete's case, taxpayers, again, such an underrepresented voice in the district, and of course, under the domes in capitals all across the nation. So again, apersonaloption.com. Thank you so much for joining us. We look forward to scaling the voice of everyone viewing today with members in Washington and of course also in your home state. So join us, apersonaloption.com, sign the petition. I have also linked to NTU's letter to Secretary Azar, signed by so many of those economists. That is something that you can copy and paste to a member that represents you in Congress or one of your 2 US senators. Very compelling information, so we encourage you to do that as well. Thank you, Pete. Thank you, Dean. We hope all of you have a wonderful day, and we look forward to ensuring HR 3's defeat this 117th Congress. So, gentlemen, thank you so much.
Thank you.
My pleasure.
Bye.